Thank you. It's an honor to be here. And I have to start off by saying I am in the Army, but the opinions represent my own. I don't represent the Department of Defense or the Army. I also have to start off by saying I'm a minority, not my ethnicity, but my age. Less than 7% of people are over 44, and that's me. The majority are young adults, and that's what we're going to talk about today. How do I overview the military in 15 minutes? It's going to be hard. So I want to use the example of someone who joins the military and take you through their career. As Barbara talked about, longitudinal is probably the way to go. So let's take Miss Green, an 18-year-old high school graduate who wants to join the military. She asked herself, should I join the military? And here's a lot of myths. The military is full of people who are uneducated, they're out of shape, and a lot of them have no other opportunity but to join the military because of legal reasons. Those are all false. In fact, 90% of those who join the military have a high school diploma. The reason that's an important factor is because those with a high school diploma are 80% likely to finish their training. As far as the legal aspects, having a record, having a felony is a disqualifying factor in joining the military. So being in trouble with the law is not applicable to those in military service. And then finally, for physical aspects, obesity is the #1 reason that people are not qualified to be in the military. So Ms. Green looks at those factors and decides, I still would like to join the military. Even with having a high school diploma, being on a lacrosse team, being physically fit, she still has to go through certain things in order to make it into the military. There are conditions that are incompatible with military service, such as seizures, such as asthma, and the military has different ways of handling people with those conditions. The first is to just say, I'm sorry. Unlike other countries where military service is required, in the United States, military service is a privilege, and it is our job, the military's job, to try and find people who have the most likely chance of succeeding in the military. So, according to the DOD 6130, there are certain conditions that are disqualifying. So if you have these conditions, cancer, etc., you are not qualified. But say you have a condition that may be a qualifying condition. When I joined, I had childhood asthma. I was disqualified, but yet I'm still here. The way that I got in was by a waiver. A board sits to decide, is this condition still compatible with military service? And if deemed that it is, either with extra tests, pulmonary function test, whatever, then a person is allowed to join the military. And then lastly, the military's response can be to rehabilitate or to get the person to the condition where they can join. Having ADD on medication is a disqualifying condition, but if you can make it a year without medicine, you're able to join the military. Weight, if you lose enough weight, you can join the military. Those are all the conditions that make it possible to join the military. How does this translate to our civilian population? Most obviously, those who are first responders. People in the military are very similar to the first responders, and that is one group that uses some of the same disqualifiers and qualifiers to join. The second one are for high-level athletes and those in strenuous jobs, also using the same qualifications in order to participate in those activities. The U.S. Military Entrance Processing Command tracks those who've had waivers. Their goal is, if we gave you a waiver, did you succeed? That is probably the one area that is very ripe for further research. Are we allowing people into the military who eventually succeed? Are we disqualifying people who could have succeeded even though they've been disqualified? Even though Ms. Green has qualified, no felonies, she still faces an opportunity or a chance of not being accepted into the military. Everyone who joins takes an Armed Forces Qualification Exam. This is a test very similar to the SAT, where you're rated by percentile, and 1 out of 5 people with a high school diploma still do not score high enough to join the military. That speaks volumes to what's already been mentioned about the need in our education system to increase the education of our young adults. The other question that arises is alcohol use. It hasn't been studied since 1999 in the military whether the increased alcohol use of soldiers, sailors, airmen is a factor that people are predisposed to, or is this something that happens because of the military? Back in 1999, the study by Bachman et al. Found that those who joined had already, about 20% had already had binge drinking and high alcohol exposure. So it wasn't a factor of joining the military. It's been 14 years. I think it's time to redo that study. So let's move on with Ms. Green. She joins the military. She has to qualify for basic and for advanced training. She decides she wants to be a military policewoman. The military takes adolescents and young adults who are at all different levels and bring them to a certain level of physical fitness and qualification. What the rest of the world can take from this is how do we use the training of military young adults and translate them into getting people who aren't so healthy, the 75% of the country who are not qualified to join, to be more physically fit and to be qualified for jobs. The DoD health-related survey, which I talked to Dr. Neinstein about, is the one survey that's done every 3 years, and it looks at high-risk behavior, alcohol drinking, binge drinking, health behavior. That is the one survey that's out there that allows us to look at the behavior of those in the military and compare them with our civilian counterparts. Compared to civilians, there's less illicit drug use, there's more alcohol use. And when you break it down by sex and which branch, it makes sense. Women don't binge as much, men binge more. Men in the Marines binge more than men in the Air Force. All that data is out there, and everything I'm talking about today is in the public sector. There's nothing top secret about what I'm talking about today. But all that information is available to compare and gives us a good information as far as where we should go from here. Once in the military, after her training, how does the military handle the need for physical capabilities and mental capabilities? There are three major ways. The elephant in the room. The military is a no-cost public health system. That has to have something to do with how we take care of our young people. That could be looked at a little bit more. But on top of the public health system that we have, all the military services require annual health assessments. The drawback with these health assessments is that they are self-reported. If a soldier, sailor, airman says, I don't want to be restricted from my job, they're going to lie. But that is one thing that we use. The second one is every service also tests each member physically, either with strength or conditioning, to make sure that they meet certain minimal standards. An annual training, including suicide awareness, and depending on your specialty, you'll get additional training, is incorporated into the military service. Difference between civilian and military, an 18 and 19-year-old can be ordered to do certain training, certain activities. Our college population cannot. The military's response while in service to providing for the health and welfare of our young adults has moved from sick call type medicine, acute care medicine, where you show up at 6:30 in the morning and wait in line until someone sees you for a few minutes, to more of the patient-centered medical home. It's a DoD directive that is, the main goal is that each individual has a medical home and will get the care that they need. It's a work in progress, but that is the way that the DoD is moving toward, and it's the right direction. Once Ms. Green finishes her service after 4 years, typically, and only about 17% of people who join the military stay in long enough to retire. But after 4 years, she gets out of the military. She has her GI Bill, which allows her to pay for school. She's a little worried because she hears the myth that 88% of people with a GI Bill don't graduate. But one survey with a Veterans Association who answered the survey, 68% said that they attained their degree, whether it was an AA or a BA or BS. So that's a little more reassuring. The other thing that's reassuring is that if she developed any health needs during the service, they will be covered by the VA. It's a little intimidating to think that you can go into a service, develop a condition, and left dangling in the wind. But the VA, for conditions that are documented, will cover health benefits of conditions that were either worsened during the military or developed during the military service. And lastly, for employment and education opportunities, it was already mentioned today about the mission continues. There are a lot of programs out there for veterans, Heroes to Hire, Hiring Our Heroes, and Partnership for Youth Services. These are all agencies that attempt to help young adults 18 to 24 assimilate into the civilian workforce. The big problem is, according to the Bureau of Labor and Statistics, veterans unemployment is about 20% from 18 to 24-year-olds compared to the 16% of non-veterans. That statistic is puzzling. You would imagine that someone with the discipline and work experience of being a veteran would be a great person to hire. So why are they not hired as often? That is an area ripe for research. And then another area that would be great to focus on of those who have finished the military is the alcohol use. Can we prevent it? Can we do something about it? The basics programs that were mentioned earlier today are also ripe to be placed right into the military setting. How do young adults respond in the military to these treatment modalities? One of the things we know about young adults in the military is peer groups are critically important. And the peer groups that are formed probably have a lot to do with how they respond to alcohol, how they respond to physical fitness. Can we use that peer group interaction to better prepare our young adults for the future? Rachel Whittam and all looked at preventing chronic problems by also looking at some of the health risk behaviors that happen. So in summary, the three different groups, before entering the military, the civilian correlate is obvious. We need to increase our education so that we have enough candidates, and most importantly, we need to increase our physical fitness for our young adults in general so that they're able to do, if the military, if that's what they want to, but any other service that they are thinking about doing. During the service, we're actively working towards increasing the medical access. We are way ahead of the rest of the country by having a public health system. And then after service, we need to continue to look at our veterans and the needs that they have of conditions they may have developed during the service, was service beneficial or was service harmful for some of the lifestyle and choices that they made. Thank you very much.
All right, great. Thank you very much, Dr. Hutchinson. One thing that we learn in the military quite early is that if you're not 5 minutes early, you're late. And I appreciate Dr. Hutchinson for finishing on the yellow. Pretty awesome. Okay, great. It is now my great pleasure to introduce our next speaker, who's going to focus a little bit more on some of the unique challenges that our military service members face. Dr. Elspeth Cameron Ritchie, who is the medical director working in DC. She's a colonel retired and has really quite a distinguished career in psychiatric and combat medicine. Will help discuss the psychological consequences of the long war.